ultimately, the only way to achieve greater health care affordability systematically is to lower underlying healthcare costs. So if we really want to see change, we have to look at the bigger picture. We have to fix the systematic gaps, right? So things you can do for yourself to help your individual healthcare costs, or you can compare insurance plans, okay? Some people qualify for financial assistance, and you can also utilize public healthcare services, right? So like free preventative services, so they do annual checkups, vaccines, and screenings. But like I said, we do have to look at things as a whole. So you have to start, when you vote for political leaders and just government officials, look into what they prioritize. So a thing you can look out for is affordable health care. Things like the Affordable Health Care Act. I have a quote about that actually. Senior health policy expert Larry Levy says that total national health spending has grown markedly slower since the Affordable Care Act was passed in 2010. So that just shows that, that's just an example of things you can look out for when, looking at politics. Some other things that you can do is you can support programs that expand Medicare and Medicaid. Those are helpful for lowering prices nationwide. So now that we've talked about solutions, let's have some visuals about what happens if we act versus if we don't act. So if we act, we can visualize, I can afford my insulin forever. People who also need medication, they can afford it. And if you're ever in an emergency, you can go seek the medical help you need without having to worry about the repercussions that come with it, right? If we don't act, we will continue to see people struggle mentally and physically. People are going to continue to drown in medical debt, and people are just going to continue to struggle, right? So the choice is up to you, but ultimately they're very different, right? The reality of two very different futures is very real. So to review main points, we talked about the problem, which is rising healthcare costs in America, the consequences, which is poor health,